Hi, my name is Shirley. I go to Dalhousie University, and I'd like to acknowledge that we are in Mi'kma'ki, the unceded territory of the Mi'kmaq people. And I'll let my co-presenter introduce herself.
Thank you, Shirley. Hello, everyone. My name is Yejin, and I am a student at the University of Toronto, which is situated on the unceded territories of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit.
So our topic is food insecurity. Food insecurity is defined as the lack of access to food due to financial constraints. And this lack of income can lead to chronic inadequate nutrition, and over time is associated with negative health outcomes, including increased risk of acute and chronic disease, poor mental health, and this poses a significant burden on the healthcare system. So currently in Canada, food is becoming increasingly unaffordable for the majority of Canadians. This leads to an increased reliance on food banks, as well as a decreased capacity of many people to donate to food banks. So in 2021, 23% of people actually reported eating less than what is nutritionally safe, and specifically implicating the rising cost of food as a factor. Due to the economic fallout from the pandemic, a lot of people are put in a vulnerable situation. And as well, recently, there's been a clawback of CERB and eviction bans. So this continues to put many people in a vulnerable situation. And particularly, children are very susceptible to the effects of food insecurity. They often have very little control over what foods they have access to, and lack of access to healthy food has been shown to have a poor effect on both their educational and their social development. It's also worthy to note that Canada is one of the only G7 countries without a national food program. As well, food insecurity is a racialized issue. Indigenous populations, particularly those in the North, have disproportionately high rates of food insecurity. And this inequity is intrinsically tied to a history of colonial policy, so addressing these discrepancies are a key part of reconciliation. So the Liberal Party has demonstrated an interest in food security. They announced their intention to work toward a national food program in 2019. However, no funding was secured. The current political climate seems to support the increased funding for charity-based approaches, such as food banks, but have done little to tackle the upstream income-based drivers of food insecurity.
So in terms of why we should advocate for this topic, there are several key reasons as to this. So firstly, this is an issue that matters to us as future healthcare professionals, given that food insecurity causes a significant healthcare burden, where research has demonstrated that approximately $2,000 more has to be spent on the healthcare system to care for and manage the conditions for an individual who is malnourished versus not malnourished, due to the higher risks of complications and the acute and chronic conditions that are associated with food insecurity. And also, food insecurity is something that touches some of the most vulnerable in our communities, including those from racialized and or low-income backgrounds, as well as Indigenous communities. So particularly those who live in the Northwest Territories and in Nunavut. And lastly, given that access to food is a fundamental human right and is also highlighted in our medical curriculum as a significant social determinant of health, we believe this is a really important issue to tackle and advocate for, particularly given that unique platform we have as medical students in promoting the health of both our current and future patients. In terms of the current approaches, Shirley had mentioned that there's a lot of focus upon funding and supporting the food banks and the downstream infrastructure that is available in Canada. So here are some of the examples of funds that are currently running. But the shortcomings, again, is that this legislation and the policies right now nationally are focusing on the downstream ways to tackle food insecurity and put food into people's hands. But in order to really address that root of food insecurity, which is poverty and not having the financial needs to be able to access nutritious foods in the first place, we're really hoping to highlight and advocate for these other kinds of solutions. So those long-term solutions will be income-based drivers of food insecurity and also social supports for the vulnerable populations, such as children and Indigenous populations in particular. And then lastly, trying to shift that focus from funding these national programs, as important as they are, to also really tackling those other social determinants of health that feed into food insecurity. Given all of that, we have compiled several asks. So the first is we're going to discuss those downstream asks, which is firstly to help with the creation of a cost-shared national school food program. So we believe that the federal government is in a position and has that platform to be able to partner with provinces and territories to ensure that children and students are able to have nutritious meals every day. And having that cost-shared model with the provinces and discussions will be very important for this. And secondly, the enhancement of measures to reduce northern food insecurity. So right now there's an organization called Nutrition North Canada, and if possible, an ask would be to have the federal government increase their subsidy budget and support for this kind of program beyond the 5% increase per year, given that we are having really increased inflation at this time and there's population growth to consider. And also with helping in terms of creation of a northern development and revitalization plan to help improve the food infrastructure, especially given the geographical limitations that are also present in the north. And then finally, some of the upstream asks we are thinking about to really tackle that poverty issue is to firstly increase and consider discussing increases to federal minimum wage and improve that income support by even just a $1 per hour increase, so that this has been by research projected to decrease the odds of food insecurity by 5% and ultimately lead to long-term healthcare savings over time, likely higher quality of life for people as well in many, many communities. And then also a decrease in the federal income tax for those in the lowest back bracket by 1% has been shown to potentially decrease odds of food insecurity by 9% and lead to those same outcomes. And these are some potential organizations that would be crucial to consult in this issue. And that is everything from us in terms of this topic of food insecurity. Thank you all very much for listening.